of the cardiologist who was specialist in treating the heart rhythm problem as well as the heart failure problem. In this event, which is conducted annually, this is the 5th time it is being conducted, and Chennaites are proud that the location has been chosen to be Chennai. I'm delighted to inform you that in addition to the well-known national faculty of the Heart Rhythm Society, we have the foreign faculty, the faculty from abroad, selectively chosen because they have the Indian origin. They are the Indian origin people who have done tremendous work, and they have been recognized all over the world for their ability and the skills in treating the rhythm disorders and the heart failure syndromes. Here on the dais, I am accompanied by, on my right hand side, Dr. Amit Vora, who is the main person behind the scientific content of this annual conference. He has given the idea and the theme or the framework how the scientific program has to be created. I am pleased to inform you that by my right side is Dr. C. Narasimhan, who happens to be the president of Indian Heart Rhythm Society. Dr. Narasimhan and Dr. Amit Vora have such a fantastic career, electrophysiology career, that they are known worldwide. I am pleased to introduce now the foreign faculty on my left hand side, Dr. Shifal Doshi and Dr. Kamundar Srivastavan. Both of them are from America, and they are the world recognized specialist in the rhythm disorders and heart failure syndromes. We five are here to take up some questions from you people, which can be up to 20 minutes from now. We have given you some materials before you came here. I hope based on that you may actually ask us questions, and we are all pleased to be interacting with you. Regardless of the age, you will have the problems associated with the rhythm of the heart and the heart failure. But there are certain groups of age where a particular problem is more prevalent. For example, in elderly, there is one particular rhythm disorder where it would lead to stroke very, very often. For example, a condition called atrial fibrillation. So in an elderly person who is beyond the age of 60 or so, the commonest rhythm disorder is atrial fibrillation, and which may cause stroke. So in other words, majority of the strokes in an elderly age group is because of an atrial fibrillation, which is a rhythm disorder. So the Indian Heart Rhythm Society is actually looking at this particular entity called atrial fibrillation. Indian Heart Rhythm Society has made a registry to find out what is this incidence of this particular arrhythmia, which can be really catastrophic. This may lead to stroke, this atrial fibrillation. So there has been attempts to in the past, but it was not done in a systematic way. In the last 2 years, Indian Heart Rhythm Society has looked specifically into this particular rhythm disorder called atrial fibrillation, which is the commonest cause of stroke in elderly people, and that is because of the rhythm disorder. Similarly, you have some other age groups where particular rhythm disorder is common. For example, in kids, if they have palpitations or abrupt loss of consciousness or fainting, majority of the times it is because of a rhythm disorder. Even though the boy is all right or the girl is all right, but suddenly they have these symptoms of palpitations or loss of consciousness or fainting. In this group, in this age group, the commonest cause of the rhythm disorder is an electrical problem they are born with. It may not be necessarily hereditary, it may not be necessarily genetically. It is just that there is an anomalous electrical system in that age group, and that is what is the commonest cause of fainting or palpitations in the pediatric age group.
So do you think above 65 are most vulnerable for this problem?
The elderly patients are prone to develop a rhythm disorder of the upper chamber of the heart called atrial fibrillation. But as I said, Dr. Ulas did mention younger age group, they have a different set of arrhythmias which can again present as children generally cannot complain of palpitation. So very often they either faint or they are brought as abdominal discomfort or they present as heart failure.
So what are the signs in the younger age group to identify that they are suffering from heart rhythm?
One of the common reasons is they can have repeated faints, or if the child is old enough, they can find a fluttering in the chest. Children who are too young, if they are having it repetitively, they tend to develop heart failure. Basically, the child main symptom from the parent will be failure to thrive. So the feeding will be less, cannot suckle at the breast for a long enough period, will be periodically taking gasps so that the child is not able to feed and they will tend to lose weight.
What you want to say is that both child and the younger generation both are prone for this.
Exactly.
But what is the age group you can define for this? Younger group?
It can be right from in utero. You can have something called as fetal arrhythmias when the child is at the stage of conception, say in the first 6 months or 8 months of conception, and you can have it as late as 90 or 100 years of age. But the spectrum of the disease is different in younger age group compared to the older age group.
Are you expected to bring some guidelines for the kind of medical equipment you use to treat these people? So are you planning to approach the government to regularize medical equipment and the kind of treatment you would have to administer to these?
Yes, so I think that's where the Indian Heart Rhythm Society is trying to analyze the heart rhythm disorders which are happening in our country, Indian patients, trying to understand what is the major problem and which is the best way to address it, and that's where all these registry studies are being done. Some important information from these studies which I would like to share with you all is that, as we said, atrial fibrillation is being studied, and in that we have found that even to this date, 45 to 50% of all atrial fibrillation patients are with rheumatic valvular heart disease. This is completely in contrast to in the Western world, where valvular heart disease, because rheumatic affection is much less common. So I think we have a different group of these atrial fibrillation patients which require different ways in which they are to be treated. Simultaneously, we also realize that in the Indian context, all these devices are expensive, and there are two ways in which we generally treat patients, either to improve their quality of life or to improve their longevity. And we realize because of the cost of these devices, the focus by the physicians, the acceptance by the patient is more when longevity is at stake. That is where, when pacemakers which are used for slow pulse, it was realized that in the Indian context, these pacemakers are utilized primarily 75% of the times only if life is at risk, as opposed to 1/4 of the times it's being used to improve the quality of life. This again is absolute contrast to what is seen in the Western world. So this is the information which we are getting, and there are certain social implications also we realize. When you talk of these expensive devices which are to be used in patients to save their lives, we realize that vast majority of the people who are getting these devices are of the male gender. So the males in our society, 60 to 75% of them will get these high-end devices, but they probably are the earning members of the family. But there is definitely a less penetration of these expensive devices in women. and that definitely has a social angle to it, and we need to address this issue collectively. And we think that the society will probably now be able to approach the government with the kind of problems which are being found out, such that we can have governmental support and governmental policies in place to see that we have wider penetration of all these therapies.
So the solution lies for this atrial fibrillation only to have pacemaker.
For atrial fibrillation, the solutions are varied, and that's where let me take the help of our international colleagues, because they're much more wider experience in this manner.
But this, in layman's perspective, what is the solution?
Yeah, I'm sure, Shifal, who also knows the Indian perspectives, even though he has done a tremendous work in US, I think he's very keen on knowing what is also happening in India, what is data that is collected, especially in atrial fibrillation. He has certain remarks and some guidelines what he would like to propose. Shifal, you would address how do we treat atrial fibrillation patients in India?
So first of all, thank you for the audience. I want to congratulate IHRS for organizing in such a manner. I think what the Indian people should realize is you have some of the most skilled electrophysiologists in the world in India. And what tends to happen with the field of cardiology is that there is a very good understanding by most people that when they think of heart disease, they think of blockages, they think of stent, they think of bypass. But they don't realize that more people suffer from electrical problems or arrhythmias than they necessarily suffer from blockages. But that is the level of understanding that has been out in the community. And the charge of IHRS, which is very applaudable, is to educate the Indian people to realize that there are other forms of heart disease, and they're very significant in terms of the complications. And as we talked about atrial fibrillation, it's an electrical short circuit in the heart, in the atrium, which causes you to get blood clots, which can then go to your brain and cause a stroke. So one of the main treatment therapies for patients with atrial fibrillation is one, to diagnose the problem. Because until you make the diagnosis, you will not be able to help the patient. And you diagnose it by educating and educating and educating. And once you make the diagnosis, there are a multitude of options for the patient. The options depend on the age, depends on how they feel, depends on their ability to take medications. And the first goal for atrial fibrillation is to protect them from having a stroke. And that's especially relevant in our population here in Asia and in India. And that may involve taking different kinds of medications to protect the heart and to prevent blood clots from forming in the heart. And the second charge in terms of reducing stroke, whether it's with medications or with procedures, is also to make a patient feel better. Some patients who have this irregular heart feel very bad. They have difficulty breathing, they get short of breath just from doing casual walking, their heart is out of rhythm. And in those cases, oftentimes, especially in the young patient, we may offer them a procedure called an ablation, where we go in with a wire into the heart and we burn the areas that are short-circuiting. So we try to fix the short circuit. So treating atrial fibrillation is very complex, many different options based on the age, based on the symptoms, based on the risk of stroke. And it's very important that we first increase the awareness to the community that if they feel these symptoms, they should see a physician and try to make a diagnosis.
How common is this procedure of ablation in India? Is it done?
How common is atrial fibrillation ablation?
See, ablation has been routinely done almost for over 20 years. And it started first in All India Institute, Delhi, and GB Pant Hospital in Delhi. But now every single major metropolitan city has 4 or 5 trained electrophysiologists who are capable of doing this ablation for arrhythmias. The atrial fibrillation ablation is probably restricted to about 5 or 6 centers in the country.
Break up the students, the
I am pleased to announce that every year the Indian Heart Rhythm Society's conference is getting bigger in size, and it is representing more and more sections of medical personnel. This is the largest of the Indian Heart Rhythm Society congregation with respect to all the departments. We have about 65 faculty from India who are actually delivering the talks, chairing the session. These 65 people or the faculty members are the trained electrophysiologists. That means they have done their cardiology, they are the cardiology specialist in any case, and then they further specialize in treating the rhythm disorder. So these are called cardiac electrophysiologists. There are about 65 faculty who is attending. There is another 100 cardiologists with an interest in electrophysiology. They happen to be the delegates. So we are almost talking about 200 cardiologists and the electrophysiologists. Nearly 75 students who are pursuing cardiology as their career, they are coming over here because they have been already inspired to become electrophysiologists in future. So this is called BM, DNB cardiology residents who are pursuing cardiology, who are keen on looking at electrophysiology as career. Indian Heart Rhythm Society has made a sincere effort in actually getting them from across the country, looking after all their expenses. We really want the younger generation to take up electrophysiology because there is so much work to be done with respect to the rhythm disorders and heart failure. So we are talking about 75 of them. First ever time, the Indian Heart Rhythm Society conference is also making room for paramedical staff. The paramedical staff are the people who actually help the electrophysiologist during their procedures. They are called cath lab technologists. We have cath lab technologists. We have physician assistant group, and we have nurses group. They are comprising about 50 in number. So the first ever time the paramedical personnel have been given an opportunity to interact with us. They are going to be presenting some paper. Our faculty is presenting them and teaching them some more advanced training program. We have those already cardiologists, electrophysiologists. We have paramedical personnel, and we have students. So I'm thinking it is touching anywhere between 300 to 350.
Recommendation.
Yeah, you see, it is all staged process. Some recommendations have already reached them. Some recommendations are being prepared. In fact, the executive body meeting and the general body meeting and the other deliberations during the conference have come to a kind of a unanimous decision that we should indeed also do one particular thing, and that is to create a fellowship in cardiac electrophysiology going to be approved by Medical Council of India, Diplomat National Board, and other government agencies which look at the educational pattern in the country. So we are going to make a sincere attempt to make a curriculum which is appealing to the students as well as appealing to the government to approve. So we are going to create really qualified electrophysiologists. Till now, in India, there is no structured program for fellowship. The Indian Heart Rhythm Society is striving hard to see to it that cardiac electrophysiology fellowship program is created, and it is going to be approved by Medical Council of India and another agency called the Diplomat National Board. So there are sincere efforts from the faculty from Indian Heart Rhythm Society, and we are taking the inputs from the faculty from abroad because they have already for almost like 4 decades since they have this electrophysiology fellowship prevalent in their country. So they are very experienced. So this is a forum where we get their inputs to make a good curriculum, to propose it to the Medical Council of India and Diplomat National Board so as to have the electrophysiology fellowship to come into the universities very, very soon.
Make a point to the audience, especially to any patients that you may be writing to. So when you think about electrophysiologists, think of them as electricians of the heart. And the one unique thing that your electrophysiologist can do, unlike any other field in medicine, we can often cure a patient with one procedure. So instead of taking medicines for 40, 50, 60 years, your electrophysiologist can do one procedure and cure the problem for the rest of their life. And that is a unique part of electrophysiology that you do not see in other parts of